Hello and welcome to my YouTube channel. Today I'll be speaking about a condition when the hands turn blue. And if this is the first time you're hearing about such a condition, it may sound like something from a cartoon or fiction movie. But if you've ever experienced that, maybe for the first time, it may have been very scary for you. So what happens when the hands turn blue? Essentially, there is a condition called Raynaud's phenomenon where the hands, the feet could change color to white, blue, and then red due to cold or stress. Now, these are two factors that could trigger cold or stress. Essentially, why then do the hands turn blue? It is due to vasospasm or narrowing. Let us assume the vessel diameter is about this size, and if for reason of cold or emotional stress, anxiety, it significantly narrows to the point where it's almost occluded, you would have a restriction or a limitation in the amount of blood that is supplying a particular area, for example, the nails or the fingers. Now, what is important to mention is the fact that when that occurs, it looks blue. You can clinically see it. The patient can observe that. Other areas can be affected. This includes the fingers, the toes that I've mentioned, the lips, the nose, and the ears. It could last from a few minutes to a few hours. Why these three colors? It's important to mention, I'm sure everyone has seen blood before. Blood looks red, but that's not to say that the only cells in the blood are red blood cells, but that's essentially the reason why blood looks red. So why these colors? Number one, initially when the vasospasm or vasoconstriction occurs, because of the restriction in the amount of blood flowing to that area, it will turn white. Then, because of that period for which blood is not getting there, remember you need oxygen. The blood carries oxygen to an area. So you now have deoxygenated blood in that area. Deoxygenated blood simply means blood that has reduced amount of oxygen. So it looks blue. After that, blood begins to flow again into that area and then it regains its color and then looks red. Other symptoms that patients may experience include numbness, tingling sensation, and then pain in the fingers. We've talked about triggers of cold temperature and stress. Anxiety can also cause Raynaud's. It's important to distinguish between two types of Raynaud's, as it were, the primary Raynaud's and then the secondary Raynaud's. For the primary Raynaud's called Raynaud's disease, there is no underlying pathology, there's no underlying disease. It's just a situation where patients are exposed to cold, the hands change color, and then it regains the color, and that's it. There's no underlying problem. However, there are some patients that experience what is called the secondary Raynaud's or Raynaud's phenomenon, in which case there is an underlying pathology. These underlying pathology could be from connective tissue diseases such as scleroderma, autoimmune problems like lupus, medications, and then people that work in organizations where they use vibrating tools. What do you do? How do you treat this condition? Number one, it depends again. If it is primary, in other words, no underlying problem, in such conditions, you would simply try to keep warm. It may be necessary for you to use specific kind of gloves. And if these measures do not work, it may be required for you to be on medications. And then for the secondary Raynaud's, where you have an underlying pathology, it's important that the doctor diagnoses the problem and then treats the underlying problem. Such patients will also require medications. I'm just going to go through a listing of the broad classification without mentioning the specific medications. It's important to mention that this lecture or this video is not intended for you to become your own doctor. Please, if you're experiencing such conditions, do see a doctor. And so I mentioned four categories of medications: calcium channel blockers, that's what we call the CCB, okay, phosphodiesterase 5 inhibitors, then endothelin receptor antagonist, and then prostacyclin analogs. These are four categories of medications we could use in addressing this condition. If you've learned something today, thank you, and I look forward to you subscribing. Bye.